I have health checkups you should avoid after 70 that may harm you more than help. There exists a profound, often unspoken truth within the realm of senior healthcare that many individuals over the age of 70 never hear from their trusted medical practitioners. Every single year, countless seniors dutifully present themselves for routine health checkups, operating under the firm belief that these appointments are the most effective way to safeguard their well being and maintain their health. However, a disking revelation emerges from recent scientific inquiry. Certain common medical tests, those frequently recommended by doctors as essential for a senior's health, may inadvertently propel individuals towards more serious interventions, such as surgery, strokes, and even the development of cancer. Emerging research paints a stark picture, indicating that a significant portion, up to 37% of medical tests conducted on seniors ultimately result in unnecessary treatments, lead to avoidable complications, or leave individuals grappling with lifelong adverse side effects. The sheer scale of this issue is astonishing, with a staggering 99% of individuals over 70 remaining unaware that they are potentially being subjected to an overwhelming number of diagnostic procedures. One particular checkup holding the unenviable position of number one on our list has been identified as a contributing factor to a substantial 5% of all cancer cases diagnosed within the United States. This figure is alarmingly comparable to the number of cancer cases attributed to the daily consumption of alcohol, a well-recognized carcinogen. This critical information is conspicuously absent from the brochures and discussions within clinic walls, and you will certainly not find it advertised on any public billboard. The truth, however, is meticulously documented within scientific literature. In this comprehensive exploration, we aim to fully unveil the 5 health checkups that seniors past the age of 70 should strongly consider avoiding alongside the truly terrifying realities of their potential impact on the human body. Every piece of information presented is rigorously supported by authentic scientific data, and prepare yourself for a shock as you discover what has landed at the second position on our list. Before we delve into the specifics of these potentially detrimental tests, we invite you to actively participate in our community. Please share with us in the comments section below your current location, your age, and whether you have ever experienced regret or negative consequences from a past medical test or procedure. Do you, in your opinion, believe that seniors are subjected to an excessive number of medical examinations? We are committed to reading and responding to every single comment, offering personalized advice and helpful tips tailored to your individual circumstances. Furthermore, we kindly request that you honor this video with a like and consider subscribing to our channel to ensure you receive a continuous stream of valuable content designed to enhance your health and well-being. Now, without any further delay, let us commence our discussion by examining the very first test on our agenda. This examination may appear entirely innocuous, yet it possesses the insidious potential to quietly and irrevocably diminish your quality of life. Number 5, bone density scan. At first glance, a bone density scan, officially known as a DEXA scan, seems entirely benign. It's a quick, painless procedure requiring no needles, after which you depart with information regarding your potential risk for fractures. However, the unvarnished truth is that beyond the age of 70, a DEXA scan often cultivates more anxiety than it provides genuine benefit. While its primary purpose is to identify osteoporosis by measuring bone strength in older adults, particularly women, the results frequently indicate a reduced bone density, even in the absence of any actual danger. This is largely because a natural decline in bone density is an inherent aspect of the aging process, akin to the development of wrinkles or the appearance of gray hair. It happens to everyone. Despite this, a multitude of seniors are consequently steered towards pharmaceutical interventions such as bisphosphonates, which are marketed to fortify bones, but carry a concerning array of serious side effects. Among these are osteonecrosis of the jaw, a rare yet devastating condition where the jawbone begins to deteriorate, and significant esophageal irritation. The core of the issue lies in the scientific evidence. Studies have demonstrated that administering medication to treat mild bone loss in individuals over 70 yields minimal to no discernible impact on actual fracture rates. A compelling study published in the Journal of the American Geriatric Society meticulously followed over 1/200 women exceeding the age of 70. The findings revealed that bisphosphonates reduced fracture risk by a mere 0.3% over a 5-year period. While not entirely negligible, this marginal benefit is a far cry from being life-saving. Instead, these women were considerably more susceptible to experiencing medication-related adverse effects, including persistent digestive issues, inflammatory conditions of the esophagus, and a paradoxical increase in bone fragility, leading to fractures. In unusual circumstances, allow us to recount the story of Rose, a spritly 76-year-old retired piano teacher. Following her annual checkup, she was referred for a DEXA scan. Rose had never experienced a fall, was completely free of pain, and maintained a daily walking routine. Her scan results indicated osteopenia, a mild decrease in bone density that does not meet the diagnostic criteria for osteoporosis. Her physician promptly initiated a course of alendronate, a bisphosphonate medication. Within 3 months of commencing treatment, Rose developed severe acid reflux and excruciating jaw pain. By the time we had the opportunity to assess her, she had been unable to play the piano for weeks. We made the decision to discontinue her medication and transitioned her to a regimen that included vitamin D supplementation, weight-bearing exercises utilizing resistance bands, and a calcium-rich diet incorporating foods such as sardines and abundant leafy green vegetables. A year later, Rose had resumed her piano recital, exhibiting improved leg strength, enhanced balance, and most importantly, had experienced no fractures. While a brief scan may appear to be a prudent measure for individuals over 70 who are not experiencing falls or fractures, a more effective and less invasive approach involves embracing lifestyle modifications, strength training, balance exercises. A focus on proper nutrition and addressing any vitamin D deficiencies have been conclusively shown to reduce fracture risk by over 20%, as evidenced by a 2022 study. Published in Osteoporosis International. We urge you not to allow a numerical reading on a diagnostic screen to precipitate a course of treatment that may be entirely unnecessary. However, there exists another type of scan that carries the potential to lead to something far more daunting: brain surgery. Let us now turn our attention to that critical concern. Number 4, brain MRI for memory loss. When seniors begin to experience increased forgetfulness or bouts of confusion, a natural and understandable response is fear. This fear is often rooted in the dread of dementia or Alzheimer's disease. Consequently, physicians frequently resort to ordering a brain MRI in an attempt to identify the underlying cause. Yet, the stark and often uncomfortable reality is that MRIs, which provide highly detailed anatomical images of the brain, rarely deliver the definitive answers that patients and their families are desperately seeking. In fact, the vast majority of MRIs performed on individuals over the age of 70 will simply reveal age-related changes. These changes are typically characterized by slight shrinkage of brain tissue or the presence of white matter spots, both of which are considered entirely normal variations in older adults. The true peril, however, lies in the cascade of events that can be triggered once these seemingly innocuous findings are observed. The presence of these spots can ignite a profound sense of fear, leading to a series of further, often invasive diagnostic tests and, in some cases, even surgery. This surgery, ironically, may not lead to any improvement in memory and could in fact exacerbate cognitive issues. A 2021 study published in Neurology Today conducted a comprehensive review of over 3,000 MRI scans performed on patients between the ages of 70 and 85 who presented with mild cognitive complaints. The study found that a remarkable 86% of these scans indicated some form of brain abnormality. However, a critically low 3% of these identified findings were directly linked to an actual treatable medical condition. This implies that a staggering 97% of individuals endured the emotional distress of being informed that something is wrong when in reality there was no significant pathological issue present. To compound this problem, nearly 12% of these patients were subsequently subjected to invasive procedures, including spinal taps or even exploratory biopsies, all based on these vague and often misinterpreted scan results. Consider the case of George, a 74-year-old retired engineer who sought medical attention due to increasing concerns about his forgetfulness. While George remained mentally sharp, he found himself misplacing his keys with greater frequency and occasionally struggling to recall names. His physician promptly ordered an MRI, which revealed changes in his white matter. This finding precipitated a significant panic in George, who became convinced he was developing dementia. He voluntarily stopped driving, ceased attending his church, and over the subsequent months, his anxiety intensified. However, upon reassessment using a standard cognitive screening test, George's scores fell well within the expected normal range for his age. We were able to explain to him that the MRI findings were consistent with normal aging. We then guided him towards lifestyle interventions, emphasizing the importance of adequate sleep, proper hydration, and engaging in brain stimulating games. Within 3 months, his memory had stabilized and he reported feeling like his former self again. The fundamental truth is that unless an individual exhibits severe neurological symptoms such as seizures, abrupt and significant personality changes, or a rapid decline in functional abilities, a brain MRI is rarely a beneficial diagnostic tool for mild memory loss. A far more effective initial step involves a cognitive screening test, which is a straightforward paper-based examination designed to evaluate memory, attention span, and problem-solving skills. This method is both cost-effective and highly accurate, crucially avoiding the unnecessary emotional toll of premature alarm. Now, please prepare yourself as the subsequent diagnostic test on our list is one that you have likely undergone on multiple occasions. It holds the third position for exceptionally compelling reasons. Number 3, cardiac stress test. The cardiac stress test is among the most commonly administered diagnostic procedures for seniors who present with complaints of mild fatigue, a sensation of chest tightness, or a general feeling of not being their usual energetic self. This test, which involves monitoring the heart's electrical activity while the patient engages in physical exertion, either on a treadmill or through the administration of medication designed to simulate exercise, is intended to detect blockages in the coronary arteries. However, for individuals exceeding the age of 70, this particular test frequently produces more adverse outcomes than beneficial ones, especially when performed on individuals who do not exhibit any clear or definitive signs of heart disease. The primary concern is its propensity to generate false alarms, which can consequently lead to unnecessary and potentially risky cardiac procedures. The inherent limitation of the stress test lies in its accuracy. Studies have indicated that in adults over the age of 70, the rate of false positives, that is when the test suggests a problem exists when in fact it does not, can be as high as 40%. This elevated rate of inaccurate results inevitably leads to further diagnostic investigations, such as angiograms, and in some instances to the placement of stances or even bypass surgery procedures that were ultimately not required. A significant study published in JAMA Cardiology in 2017 analyzed data from a vast number of patients and concluded that more than half of all stances placed following referrals from stress tests were performed on patients who had neither overt symptoms nor any demonstrable benefit from the intervention. Crucially, these patients experienced no measurable improvement in their survival rates or their overall quality of life following the procedure. What they did experience, however, were increased rates of bleeding complications, kidney damage resulting from the contrast dyes used during the procedures, and prolonged hospital stays. This unfortunate scenario befell Raymond, a robust 75-year-old retired postman who maintained a physically active lifestyle through daily walking. During a routine checkup, he casually mentioned experiencing occasional fatigue when navigating inclines. His physician, acting on a precautionary principle, scheduled a stress test to rule out any cardiac issues. The results of the stress test were equivocal, prompting a referral for a cardiac catheterization, a procedure involving the insertion of a thin tube into the arteries to assess for blockages. A minor narrowing was identified and a stent was subsequently implanted. Tragically, that same night, Raymond suffered an adverse reaction to the contrast dye, leading to the development of kidney problems. He remained hospitalized for 6 days and required weeks of follow up care. His initial fatigue, however, never resolved, as it was not, in fact, a cardiac issue. He was simply an older gentleman who would have benefited from improved hydration and more adequate rest periods between meals. If you are over 70 and are not experiencing classic cardiac symptoms such as chest pain during exertion, shortness of breath during physical activity, or a significant and abrupt decline in energy levels during light exercise, then a stress test may indeed inflict more harm than good. A more judicious alternative often involves a resting electrocardiogram (EKG), a non invasive test that evaluates the heart's rhythm while the patient is at rest, or a coronary calcium scan, a low radiation imaging technique that visualizes the extent of dangerous plaque buildup in the arteries. These are safer, more straightforward, and significantly less likely to compel you into undergoing procedures that are ultimately unnecessary. Number two, colonoscopy. It is highly probable that this particular procedure was not among your anticipated entries on a list of avoidable medical tests. A colonoscopy, which utilizes a flexible camera to meticulously examine the internal lining of the colon, is not consistently a prudent choice for individuals beyond the age of 70. And it is almost never recommended for those over 75 unless specific symptoms warrant its performance. The inherent risks associated with this procedure escalate significantly with advancing age. The preparation phase is often arduous, necessitating the consumption of potent laxatives that can lead to dehydration, dizziness, and potential kidney complications. Furthermore, the sedation employed during the procedure poses an additional risk to cognitive function in older adults. Perhaps the most surprising aspect is that the colonoscopy itself can precipitate complications including bleeding, perforation of the bowel, or even disturbances in heart rhythm during the period of sedation. A significant study published in JAMA Internal Medicine in 2019 meticulously analyzed the medical records of over 1.3 million Medicare beneficiaries aged 70 and older. The findings were stark. For every 1,000 colonoscopies performed on patients over the age of 75, only 2 lives were demonstrably saved, while over 20 individuals experienced severe and debilitating complications. This translates to a concerning 10.1 risk to benefit ratio. Moreover, even when polyps are detected, a substantial proportion are small and exhibit slow growth patterns. In an older adult, the removal of such benign growths can occasionally result in more harm than allowing them to remain undisturbed. Consider the case of Dana, a vibrant 73-year-old grandmother who actively managed a small bakery alongside her daughter. Dana presented with no concerning symptoms, no rectal bleeding, no alterations in her bowel habits, and no familial history of colon cancer. However, her new primary care physician, a recent medical school graduate, strongly urged her to undergo a screening colonoscopy. Dana agreed. During the procedure, a small polyp was successfully removed and she was discharged home. Later that night, Dana experienced excruciating abdominal pain and subsequently fainted. Upon admission to the hospital, it was discovered that she had sustained a bowel perforation. She endured a 9-day recovery period, lost 10 pounds, and has not fully regained her previous level of well being since the incident. Upon our review of her medical history, we discovered that Dana had already undergone 2 prior colonoscopies, both of which had yielded clear results. Consequently, there was no medical justification for repeating the procedure, the U.S. Preventive Services task. Force currently advises against routine colon cancer screening for most individuals after the age of 75. For those who are in exceptionally good health, a stool-based test such as the fecal immunochemical test fit, which is a non-invasive at-home test, often represents a safer and more appropriate alternative. This test requires no arduous preparation, no sedation, and still possesses the capability to detect the vast majority of concerning cases. We strongly encourage you to engage in a thorough discussion with your physician regarding alternative screening methods, as once you are caught in the diagnostic pipeline of colonoscopies, extricating yourself can prove to be an exceedingly difficult endeavor. Number one, annual full body CT scans. We have now arrived at the most frequently overused, the most inherently dangerous, and consequently the most detrimental checkup for individuals in their senior years. It is a procedure that you have almost certainly undergone. Annual full body CT scans, sometimes offered as part of comprehensive executive health packages or promoted as preventative services by private clinics, are ostensibly marketed as a tool for the early detection of cancer. However, the truly alarming reality is far more concerning. These scans subject the entire body to a high dose of ionizing radiation. For older adults, particularly those over the age of 70, the likelihood of triggering unnecessary follow up examinations, invasive biopsies, and even surgical interventions is exceptionally high. The profound irony is that there exists a complete absence of scientific evidence to support the notion that full body scans performed on asymptomatic individuals contribute to saving lives. Each individual scan delivers a radiation dose ranging from 10 to 20 millisieverts, an amount equivalent to approximately 500 chest x rays. According to a 2023 modeling study published in JAMA Internal Medicine, the widespread proliferation of CT scans across the United States may now be directly responsible for as much as 5% of all cancer diagnoses. This places full body CT scans on par with alcohol consumption as a significant cancer-causing factor. To put this into perspective, 1 out of every 20 cancers could potentially be initiated by a scan that was intended to prevent disease. This outcome is not merely counterproductive. It is profoundly terrifying. These scans possess the capacity to detect seemingly innocuous nodules, calcifications, or cysts that are simply a natural part of the aging process. However, the moment these findings are observed, an alarm is triggered, initiating a chain reaction of further investigations, including additional scans, biopsies, and ultimately a surge of anxiety and fear. Allow us to share the story of Marcus, an active 80-year-old gentleman who formerly instructed martial arts to younger seniors. Marcus felt in excellent health and participated in a comprehensive senior elite checkup at a private clinic. His full body scan revealed a minuscule 3-miter nodule, which subsequently set in motion a cascade of medical interventions. He was referred to oncology, underwent a PET scan, and eventually submitted to a needle biopsy. The outcome of the biopsy was benign, meaning the nodule was not cancerous. However, the biopsy procedure itself resulted in a partial collapse of his lung, necessitating hospitalization and a 2-month recovery period. All of this was for a finding that could have been safely monitored without intervention. Medical experts now unequivocally advise that full-body CT scans should never be employed for general screening purposes in individuals who are not experiencing any symptoms. The American College of Radiology has issued clear guidelines stating that there is no proven benefit to such screenings and a significant potential for harm. If an individual presents with specific symptoms such as unexplained weight loss, coughing up blood, or visible swelling, then targeted imaging techniques are certainly indicated. However, the practice of scanning the entire body without a specific focus is akin to attempting to locate buried treasure using a landmine detector. While you might indeed discover something, the potential for collateral damage could far outweigh the value of your discovery. A safer, more intelligent approach involves actively listening to your body. If you feel well, it is prudent to maintain regular checkups with your primary care physician and to only undergo diagnostic tests that are clearly and unequivocally indicated by your specific health concerns. Your time, your energy, and your health are invaluable commodities far too precious to be squandered on fear-driven screening protocols that could ultimately leave you in a worse state than you were initially. Thus, you have been presented with a comprehensive overview of 5 medical checkups that may appear beneficial on the surface, but can in reality inflict harm, particularly for individuals over the age of 70. While modern medicine possesses extraordinary power, it is not infallible. In certain circumstances, less intervention can indeed translate to more positive outcomes. Always ask the critical question, what happens next? If this particular test reveals something, if the findings are ambiguous, or if the potential risks significantly outweigh the potential benefits, it may be a prudent time to pause and reconsider. Remember, true prevention originates from adopting a healthy lifestyle. Remain active, nourish your body with wholesome foods, prioritize deep and restorative sleep, and make informed decisions regarding your medical examinations. Now, we are eager to hear from you. Have you or has a loved one ever experienced complications from a medical test or treatment that in retrospect proved to be unnecessary? Please share your experiences and perspectives in the comments section below. We sincerely look forward to engaging with your insights. Thank you for dedicating your time to watch this presentation.